Hi guys, welcome back to my channel on health and wellness, especially for women. I thought today let's talk about something which is very common and it affects so many women, and sometimes they really don't know that they are suffering from this problem, and that is PMS. PMS or premenstrual syndrome. If you were to ask me what it is and how do you identify it and what do you do about it, so I would share a few tips about how to reduce this problem of PMS. PMS is nothing but premenstrual syndrome, and it is a combination of physical problems. Sometimes there are also emotional, and sometimes there are a lot of mood changes also. So the physical problems could be, sometimes you have a lower tummy pain, sometimes you are having a feeling of bloating sensation, sometimes you feel some kind of weakness, or there could even be migraines and headaches associated with the PMS. Emotionally, women feel very much on the edge. They are angry, irritable. There could be a lot of mood changes, mood swings. They could also become very anxious, very flustered, and even sometimes they get very depressed. So there can be different types of emotional effects just before the period. So if you have this regular kind of a pattern whereby at some point of time in the month you feel quite okay and happy, whereas at some point of time you really feel that the world is going to end and it's like doomsday, and you feel really sad and depressed, probably you're suffering from PMS. Now, how do you identify PMS? So basically what we do is, when somebody comes with these problems where, in a regular manner or in a cyclical pattern, they go through these emotions and they go through these physical changes and behavioral changes month and month after, we ask you to keep a menstrual diary or a PMS diary. So over the next 1 month or 2 months, you can just note down when you're feeling irritable, and you can just note down in the calendar as to, is it just before your period? So if just before your period, maybe 3 days, 4 days, or even up to a week before your period, you are getting very irritable, you're feeling very heavy, you're feeling very bloated, you're not feeling yourself, probably this is PMS. So there is no kind of a magic test or an investigation by which we can diagnose PMS, but it is just based on your symptoms, which is your menstrual diary. What we suggest for PMS is that you don't have to suffer from PMS. Once we have recognized that these symptoms are happening every month and it is probably more before your period, we give you certain tips and tricks by which you can manage this problem. So most common thing is that you can avoid caffeine, you can avoid too much of alcohol just before your period, because these add on to the bloating sensation and to the feeling of heaviness and also the irritability that you can have. We all know about serotonin, which is a happy hormone. So if you have the habit of, when you feel low, you're just taking some sugar or a bar of chocolate, this will increase your serotonin level and you will feel good for some time, but as the levels go up, they come crashing down in the same manner. So you will feel good as you take a bar of chocolate, and you will also, it will just be crashing down, and you will feel as low or even worse than before you took that chocolate. So if you think that you are feeling low and you're feeling feeling sad before your period, it is time that you could engage in activities which probably make you feel good for a longer time, such as join some yoga, some regular exercise, meeting out with friends, or even something simple as a massage, or talking to your friends, whereby when you let out, when you share your feelings, it is a feel good which stays for a longer time. Another thing is sleep. So if you are feeling unwell and you're not feeling too good just before your period, and it is part of this PMS, getting good sleep and good rest can really go a long way in helping you tide over these problems. So as I told you, a good diet, try to take more of natural fruits and vegetables, and try to avoid a lot of processed stuff just before your period. Maybe you can have in moderation things which are very high in salt and sugar and refined flour, because these are going to make you feel good in the short term, but as your sugar levels and your caffeine levels come down, you're going to feel worse than you felt before. So PMS is sometimes difficult, it is sometimes even difficult to recognize, but if you're at it and if you are able to, meet your doctor, get an idea that this is PMS, sometimes we may also give you certain medications, sometimes your B vitamins, sometimes we give vitamin E supplements and a lot of other vitamin supplements, primrose oil, and there are sometimes you may need even anti-anxiety medications if it is really troubling you so much. So don't suffer in silence. Understand that if you're not feeling well for a particular period of time, every month, do reach out. Try all these simple remedies of diet, exercise, yoga, mindfulness, reaching out. And if it still doesn't help, do not suffer. Meet your gynec, meet your doctor, and get this sorted. Thank you and take care.